morning, everybody. I'm Joe Mothy. For those who are regulars, you'll notice one change. You might notice one change. Lisa Strandberg is in my office, my typical office, and I'm in hers, and we've switched spots, which isn't quite true. Lisa Stramberg is the new executive director for Pillars. We're thrilled about that. We're going to talk about that in a little bit. And I've moved to Lisa's office, but I will not be doing the community engagement director role. That is way too hard. I'm going to retire in a couple of weeks, but we'll talk about Lisa in the new role. We are really happy to have everybody here today. We're talking about homelessness and mental health and an introduction to our new executive director. We've got some great guests that I'll introduce, but first, what we always like to do is get a sense of who's here. So Ayanda, if you could launch our poll, this just kind of helps us orient to who's with us and what's your relationship with Pillars. And do you have the poll, Ayanda? Oh.
Yes, Joe, it's going. People are filling it out.
Oh, it is. I just can't see it. Okay.
All right, and it looks like we've got some community members, some board members here, and some full volunteers. We've got some Pillars partners and some media today and some Pillars staff.
Okay, a little of everybody.
Yeah.
I was also going to say, for those, I know a lot of people at this point are familiar with Zoom, but there is a chat feature. You can ask questions or make comments there as well. Since this is Conversations Over Coffee, if you want one thing you could put in the chat is, are you enjoying a special coffee today and what kind? So I think it's vanilla hazelnut in the office today. So, but if you've got a special coffee, you can put that in as well. So let me do a quick launch of our PowerPoint. I'll be going back and forth with this. So here we are, Conversations Over Coffee. There's one you don't want to miss, Executive Director Emeritus. I did not make that slide, but it's got a nice ring to it. And we always want to ground ourselves in kind of what we do and who we are. So I won't read this to you, but wanted you to, again, see our mission, right? That a full range of shelter support and solutions, a broad continuum of that for our community. And our vision is that we want to do this well. We want to be innovative. We want to be effective in how we do it. And we want to connect with people experiencing homelessness and make that hopefully the one time and a short time that people experience that. And if people aren't to that point of homelessness, that we're doing some preventive measures there as well. We base ourselves on respect, collaboration, empowerment, and grit. That's how we kind of measure the quality of who we are and what we do. This is our Pillars at a glance, and you can see why we have Conversations Over Coffee. There are a lot of pieces to what we do. When you look comprehensively at homelessness and housing instability and poverty in a community, it takes a lot. So we go all the way from prevention programs to connecting with unsheltered people on the street to shelters, a resource center, a variety of supporting housing programs, youth-oriented program, and affordable housing. That is our full spectrum. And today, you know, a lot of times we'll go into a program. Today, we're going to talk about things that kind of transcend everything on this continuum, which is what are some of the mental health challenges we see, and how do we approach that regardless of where we connect with a client or with the community. Now, before we get into that, we want to welcome Lisa into her new executive director role, of which I'm realizing I had some questions that I was going to ask her, and I did not get those up. So I'll do that as we're talking. So maybe we'll start just with Lisa a little bit of your background and like what draw. So for everybody who knows, and I know we have some new people, but Lisa's been with us for over 2 years as community engagement director. That gives me the ability just to have incredible confidence in Lisa's ability to do this job. We have worked shoulder to shoulder for over 2 years. She understands the organization. She understands our mission. She is bright and compassionate and well respected in the community and within the agency. So you got all the stuff to do the job, but what draws you to this kind of work, Lisa?
Thanks, Joe, for those kind words. I would say the thing that draws me to the work here at Pillars is that there really is nothing more fundamental than home. I am a person who's always looking for meaning in my life and every aspect of it. And home for me, for all of us, is the stable ground on which our lives are built. We learn how to be ourselves at home. It's where we retreat to when we most want to be ourselves. And when someone is lacking that stable ground, everything in life is harder. Everything in life is health is more difficult, work is more difficult, relationships are more difficult. And so the thing that draws me to the work is creating the stability of home for all people in the community, everyone. That's the thing. That's what makes me happy to get out of bed every morning and come in and work for Pillars.
That'll do it. That as a foundational piece of any life, right? It just allows so much more to happen. Can you talk about your background a little bit? You've got quite a varied background then to bring you to us, and I've seen you like bring all of that to bear every day. So just give us a little recap of your background.
Sure. My career is a bit of a winding road. I moved to the Fox Cities in the mid-90s to work for Kimberly-Clark. My education is in chemical engineering. So my first job out of college was as a scientist in the research and development department at KC. So I worked on Huggies diapers and spent 5 years there doing that. My career took a turn toward home at one stage there, 5 years into my work, that I stayed home with our children for a time. And during that time, built a business as a freelance writer. So both engineering and writing, a combination of skill sets that I think a lot of people consider unusual, but I loved becoming a storyteller. And I told stories for a number of different companies, for a number of different media outlets. That freelance work, which I engaged in for about 8 years or so, with a brief stint at Fox Cities Magazine as an editor, led me eventually to nonprofit work. Samaritan Counseling Center of the Fox Valley, now known simply as Samaritan, was one of my clients. And we, the executive director there, and I developed a development role for me, 10 or 12 hours a week. They hadn't had the development function, the fundraising function there. And I worked for 7 years to build out that function and to help that organization thrive. From there, I spent 18 months with an initiative called Intersector. That was an initiative funded by the J.J. Keller Foundation. And it really looked at nonprofit back offices and building capacity in those functions that are often invisible when you think of a nonprofit, the HR function, the finance function, IT, that sort of thing. So got to spend a lot of time with a lot of nonprofit leaders and was trusted by a lot of nonprofit leaders to come alongside them and take a close look at their operations and help them think about where they most needed to build capacity and create ways for them to do that. Intersector eventually led here to Pillars. Joe Mothy was part of the advisory team for Intersector. And when the opportunity here to lead a team and to be part of that vital work of creating home, which I had done years ago when I started my family 21 or so years ago, when that opportunity came up, I was thrilled to embrace it. So I have a love for data due to my background, metrics orientation, which is really important in the nonprofit sector. I love to tell stories, which as an executive director is a vital part of the work. I built a development function, and again, very important to make sure that the mission is funded. There is no mission without the money to make it happen. And I have established a good deal of trust in the nonprofit community from Oshkosh to Green Bay. So varied background, which means a variety of skills and a variety of relationships built over the years.
You know, I'd add that what I've learned is kind of a life lived properly. Nothing is wasted, right? Everything that's there at the time, it might not have felt like it was worth a lot, but it comes back in one way or another. And lest anybody think that this was a gimme, you know, we hired a search firm. When I announced my retirement, we hired a search firm, did a national search with 100+ calls, like reaching out to candidates, narrowed that down to about 35 candidates that we thought were in some way qualified, narrowed that down to another 10 and did interviews, or 7 did interviews with our board members, and got that down to 2. It was a rigorous process, and every step of the process, Lisa popped to the top, and we said, this is the person that we want leading this organization and leading this community on topics of homelessness. So Lisa, maybe tell us about the team that you'll be leading.
Well, many of them are here. Pillar staff, if you're here, wave. Yeah, we've got a lot of, so our staff like to take this opportunity to learn about areas of Pillars that they might want to know more about as well. The team I'll be leading most closely, of course, is the leadership team at Pillars. So leaders, I know several of you are out there too, raise your hand. We've got Kathy Dean, Rachel Youngquist, Ann Muller, Tara Prawl, great group of leaders, people that I am thrilled to link arms with, think hard with, and make the magic happen here at Pillars. I couldn't do it without them. They're the experts. So deep experience, and thrilled to be alongside them. We've got 70 of the most compassionate and creative team members on staff here, and it's a privilege to see what they are capable of, to empower them and watch them do what they're able to do. It's amazing. We have 14 board members, and I know a few of you are on too. If you're here, wave, if you got your camera on. They put their heads and hearts to work for our mission too, every day, and thrilled to be leading that group. But I really think of our team expansively. So as I lead Pillars, I'm not leading just the staff. I'm leading all of you as well. The work that it takes to address homelessness and housing issues in the community is a community-wide effort. It's not just Pillars' job, it's all of our jobs. So I really think of our partners, our collaborative partners, and partnership is one of those partners. You'll hear from them soon. But we've got many, there are many issues that lead to homelessness, and many other nonprofits out there who are addressing those issues. So I think of coming alongside the leaders of those organizations. I think of coming alongside our funders, our municipalities who make our work happen and work alongside us to address issues in the community. I think of our donors and our volunteers. That our team is huge, thousands strong, and our team really is as big as the Fox Cities. That's the team, and it's humbling. It's humbling to lead a team of that size and that scale and with that much heart.
All right. So one last question is when you think about the future, anything you can share about your vision for Pillars and where that goes in the future? Yeah,
the place that I hope to begin is with our values, and you saw them at the start. Respect, collaboration, empowerment, and grit. Many of you know that Pillars went through a merger. We were formed through the merger of 3 housing and homelessness nonprofits back in 2018. Late 2018. So a year and a half into merging, and mergers are not easy. If you've been through one, you know that it's a complicated thing. A year and a half into our merger, something called COVID arose and took our attention off of strengthening our team and building our team identity and to addressing the needs of those most vulnerable in our community who didn't have a place to be safer at home. So it's time, again, as we still continue to address and struggle with and handle skillfully the needs that COVID presents, it's time for us to turn inward too. So I see a pillars with a strong sense of self, a strong sense of identity. I see a pillars with a solid sense of direction. I see a pillars with the capacity to inspire and engage all of you, the rest of our team out in the community, to be creative and compassionate alongside of us in addressing those community issues collectively that contribute to homelessness and housing instability for folks. And I look forward to partnering with all of you. That this issue is too big for 70 folks to handle alone. When you see an issue out in the community, when you see someone who's suffering, I envision a community that's compassionate, that responds. Compassion means to suffer with, who sees the suffering out there and who reaches out to those who can help. And that's us, that's Pillars. So when there's someone out there who is experiencing homelessness, call us. And we have the experts in-house who know how to come alongside those folks and serve them well, serve them with skill. Practice compassion alongside us. That's my vision.
That's terrific. Thanks, Lisa. It's yeah, we always never envision ourselves, right? It's a bad day when we think we're in this alone, right? When we realize that we've got the community behind us, and especially the conversations over coffee is a great reminder of that, of people who are interested and passionate and part of our team. That really lifts us up and makes the team stronger. So Lisa, welcome to the role. You're going to do great in it. The Pillars and this community is very fortunate to have you at the helm, and I know you're going to do great things here. Anything we left out? Any last thoughts to share, or are you ready to move on?
I am ready to move on. I was taking a peek at the chat to see if anyone had any lingering questions for me, but all I'm experiencing now is jealousy over what everybody's sipping on. So
it's good coffee this morning. Okay, great. Well, yes, you'll be seeing a lot more of Lisa, and again, I think Pillars is really poised. And without getting into it, a lot of things have been happening lately. The strength of the leadership team, the work that the leadership team is doing coming out of COVID, it feels like we are particularly poised to do continue to do the good things we're doing and do some great things in the near future. So I am looking forward to seeing that happen and participating as a volunteer and a conversation over coffee participant. So let me move on with the program and introduce our guests today, of which we have 3 of the 4. Isaiah actually took ill and couldn't make the meeting, so Amber's going to cover, but I'll do kind of a quick I guess counterclockwise spin around the board here. Wayne Tim is our shelter case manager at the adult shelter. Wayne's been with us since 2019. He started out as a peer support and a recovery coach, working at the resource center. And then we had this great opportunity to add case management at the adult shelter. So we know that case management is a little bit of the magic that that Pillars brings to our clients, starting to work with how can we progress through this experience of homelessness and on to the next chapter in your story. So Wayne took on the role of being the first one, and that means figuring out a lot of how do we do this. Case manager. So Wayne helps people out of homelessness. He refers people to low-income housing. He supports their mental health and their physical health. He's somebody to talk to, think things through with, connect to resources in the community. And so much of that is about communicating and building trust and finding a way, right? Finding a hopeful way through this point in life. So Wayne's got a lot to share with us today about about mental health and what he sees there, and what we need to know and how we work with that. Brady Bushberger is shelter case manager at our other shelter, the Adult and Family Shelter. He's been with Pillars for over 4 years. Started out as a housing navigator, trying to figure out how we could connect better to housing and have those relationships in the community. Brady's an Appleton native. He grew up here, attended UW-Platteville, studied psychology and criminal justice, and has just had a great social services experience, working at Oshkosh Correctional, the Chemical Abuse Center, Family Services. And Brady just really, he's at the family shelter now. He's connecting with individuals and families there and doing that same kind of thing, which is understanding where they are, what their barriers are, what their strengths are, and how do we leverage all of that into something better for the future. Amber is a health advocate with Partnership Community Health Center. She's provided support for people experiencing homelessness since 2013. Initially at COTS, then she started health advocacy work in 2016 with Partnership Community Health Center. She put a satellite clinic in at COTS, joined Partnership in 2018, and really has a great reputation, and is known at local, state, and national level in some of the presentations she's done. And she was inducted into the Clinicians Network Steering Committee for National Healthcare for the Homelessness Council. So well-versed in this topic of homelessness, and then where mental health plays into that. So welcome, Wayne, Brady, and Amber. I am going to stop my share. I'm going to add a general question to everybody. Can you talk about the fact that mental illness is often a root cause of homelessness? That it's one thing to say that, but it's another thing to experience that. So what from your experience can bring that to life of mental health as a cause of homelessness?
Oh,
go ahead, Brady.
All right. The mental health is a main block when it comes to families coming into shelter. It's one of the main things I like to focus on, because if you're not, it's like us in this field. If you're not taking care of yourself and keeping yourself healthy, then other points in your life are not going to be consistent and healthy at the same time. So the hardest part is definitely making that first step to come into shelter. And then the other part is really supporting them in a way to where they make that step forward to have that support in mental health. Because many times when it comes to mental health, it's co-occurrent with substance use. And between the two of them, it is hard to not only make that connection for mental health and get psychiatry or counseling, but it's also right now with COVID and everything, it's a 2-month waiting list to get into those things as well.
Thanks, Brady. Amber, what are you seeing as mental health kind of is that root cause?
So, in talking with some of our providers here at Partnership Community Health Center, one thing that really stands out to us, we tend to care for these individuals once they're already experiencing homelessness, right? Like by the time they get to us, they've been unstable for quite some time. And what we're really seeing is that these individuals are reporting, when I'm doing outreach out at the shelters, they're telling me, hey, I have not seen a doctor in several years. I've been off of medications for a long time. So these are people that I feel like were stable on medication, seeing doctors at one point, and then something happens. Maybe they couldn't afford their meds, or they didn't have health insurance and just didn't know how to navigate that. Insurance is a very challenging thing to try to work through, even for those of us that, know a lot about, the medical field and everything. I myself am a certified application counselor and help individuals enroll into marketplace insurance. And I feel like I still have a lot I can learn. So just for somebody in that situation to figure out how am I going to keep up with my meds and my doctor visits when everything else in their life is kind of unraveling and falling apart, I imagine must be very challenging. And that's something that we try to help them work through at Partnership. We've got an insurance enrollment department. So, you know, anybody that comes to us, questions about health insurance or, you know, needs help enrolling, we get them set up and we make sure we can get them back on medications and help them to get stable.
Yeah, that's always the thing. There are so many pieces and those are not easy pieces. So the system is complicated. And if you're suffering throughout that for a variety of reasons, it makes it all the harder. Wayne, what do you see at the adult shelter in terms of kind of mental health on the front end of a homelessness experience?
I'm finding that a lot of people when they first come in are in what we call crisis mode. You know, they like we talked earlier, they don't necessarily have the supports that they. Okay, I'll start my video. They don't have the supports that they need at the beginning of their stay with us, and it's usually we deal with a lot of transient people as well, people that are not necessarily even from the city of Appleton, so they have to establish not only the mental health supports that they need up here, but they also need to establish their geography and know where places are and things like that. So all this kind of adds to their to the mental health deteriorating even a little bit more, and the anxiety that comes about when you're in unfamiliar territory and things like that. So a lot of times just connecting them with a healthcare provider, somebody that will give them that mental health supports is pretty important. And the other thing I find that what's happened a lot is, you know, they experience a lot of things when they're out on the streets, like they'll have their, you know, their belongings will either get stolen or they'll lose their belongings, or like the other day, this wasn't mental health related, but you know, when the weather affects the people's belongings, stuff gets wet, they lose their documentation. It becomes a very stressful time for people at the beginning of the process. So that's where I try to step in and provide as much support as I can. Thanks,
Wayne. Yeah, and I would guess too, you know, mental health takes its toll on people around an individual who's struggling with that as well. And we see some of that as well, you know, as your support network starts to fray a little bit or step away. You know, a lot of times there's nowhere else to go. Does any one of the three of you, does a specific, like put a story to it, put a face to it, anybody come to mind that you've worked with recently who kind of fits that bill of had some mental health challenges and that ultimately was kind of the path that led them to Pillars?
I had one, Joe. Actually, this was one I recently shared with staff, as it was a great success for Pillars, but it ultimately is mental health really. Well, anyways, I'll start at the beginning. So we'll call him Mike. So Mike stayed in shelter for probably like 90 days after staying on the streets, and we worked together for a while, but his mental health seemed to be so severe and apparent that he wasn't able to hold a job. He wasn't able to make connections with his doctors. His anxiety was so crippling at the time. He had one of the worst bouts of anxiety I've seen. He also had severe ADHD. So it really showed as almost someone who's in active use. So you really people even kind of shied away from him, his relationships. He didn't have people around him. So There was actually at the time, because it was early in COVID, there was a 3-month waiting list to even get into the doctor, to get the connection then to counseling as well, and get on his meds. So he had this erratic behavior. Through a rapport, he said he'd trust the process with me, and he ended up taking a step back and going back to the adult shelter from the adult and family shelter, because right now in the moment we couldn't hold a job. We couldn't start working forward towards housing. So he actually did take that step backwards, went to the adult shelter, and it's not really a step backwards, it's more of a lateral movement. And while he was there, he took that time to get the connection to a doctor, got psychiatry, he got on his meds, he was holding a job, and by the time he came back into our shelter, like I told him we would have him come back, once he was at a point, he had $700 saved actually. When we got back together to meet, he was complete 180 of the just his behavior. He was able to sit still. He was able to, he was proud of holding the job. He was thanking me so much for being able to come back in. And he really took that lateral movement to heart and really pushed for it to come back. So he came back into shelter in the override. He had $700 saved. He had a part-time job. He was a very important part of this was the whole time he was waiting for a Social Security benefit answer. So he was basically in a waiting process of whether or not he's going to get Social Security. So when you do that, you can't make more than $1,200. His mental health was pretty apparent, and he felt pretty stagnant. So came back into shelter, super grateful. His first basis was getting his mental health under control. He was able to hold a job. He got reconnection with his family. He had a girlfriend at the time, and he actually ended up moving to one of our single room occupancy houses, which was awesome, because he didn't have much rental reference at all, and didn't have good rental references. So moved to our SRO house, now has that rental reference there. He's continuing his SSDI claim. He's going to have a positive rental reference. He had over $1,000 saved once he moved out. He was in just a really good spot, but it took a lot of work, and it took a lot of his own motivation as well to keep going with that. When you make that lateral movement to another shelter and then make sure that you're connecting to mental health and continue a job, all that, it was amazing. So
yeah, and wow, that's a great story, Bray. And it takes a lot of time. That's the thing I have to say that always surprises me, because we think, okay, well, let's get working on this, and the pace, so many things are out of your control. The ability to connect to benefits and insurances, as you mentioned, Amber, the ability to even get a doctor's appointment in a system that is overworked there, the time it takes to, especially in mental health situations, sometimes for medicine to be able to take its full effect and find out that that's the right one. I mean, the time to rebuild social connections that you've lost, all of that takes time. So we've got to we and the clients have to be in it for the long run.
Yeah.
Yeah. Amber, can you talk a little bit about that? Like how you mentioned it earlier, how we help somebody process through that in a way that we can be more efficient of connecting to services.
So I actually do have kind of my own story to share about somebody that was struggling with mental health, longtime Pillars client, that I would see it probably every week before the pandemic. He was in that Pillars Resource Center when I was there for my regular outreach. And because of the regularity of me being there and having conversations with him, we had built up this trusting relationship, and he was struggling so much with his mental health, and had actually at one point reached out to me. I was the one person that popped up in his head. He was having suicidal thoughts, and for whatever reason decided that he was going to try to reach me. And to me, that was huge to have that kind of relationship was somebody that they felt they could reach out when they were struggling with that. And I was able to get law enforcement over there just to kind of do a wellness check. And he, you know, they were able to get him to the hospital. And luckily he was stable after that. The last time I checked in with him, you know, he's been stable in his own apartment and everything like that, you know. And I just sometimes think if I hadn't been out in the community building that relationship, is there anyone he would have had the thought to reach out to? You know, would he still be here today? I don't know. So I think the importance of what I do is just being out there, building that trust. We talk a lot in my field about trauma-informed care and that approach. So basically, my thought is that I'm there to let somebody tell me their story. I'm not there to say, hey, you're going to get connected to partnership. I don't care what you're ready for right now. You know, obviously it's really important that somebody has medical care, right? That they're getting behavioral health taken care of. But I give them, you know, just a brief little assessment that lets them say, these are the services I'm ready to receive. You know, we recognize at partnership that our patients are an important part of the care team. So we want them to feel like they're not being forced into something they're not ready for, you know, and realizing they have a lot going on right now. So just the fact that they can schedule one appointment with us and make it to that one appointment is just a huge step for them. So providing, you know, that kind of support and just letting them kind of, you know, write their own path. And that's kind of my role. As their health advocate, yeah, I'm there to advocate for their healthcare needs, right, and get them connected to any services they need. But at the end of the day, I want them to learn how to advocate for themselves. And I do see that a lot. In fact, just a couple weeks ago at Pillars, when I was there for outreach at the family shelter, I had an individual say to somebody else in the room, you know, somebody else staying at the shelter, hey, have you talked to Amber yet? You know, I think she can really help you. And, you know, this individual actually had a doctor at another facility and he just didn't care for his doctor and wasn't getting the care he needed. But because this other client had said, hey, I've already worked with her and partnership is great. This individual, you know, came and talked to me and decided that he was going to schedule there too. So just that word of mouth and, you know, just the effectiveness of me being there, building those relationships.
What a great example, Amber. You know, that phrase, you know, one trusted person in your life, boy, can that make a difference if you could trust one person. And then if that reputation builds and more people just inherently kind of trust you and learn that on their own, that's when good things happen.
Hey,
yeah.
Joe.
Yeah.
Can I jump in? Because
yeah.
I'm feeling the vision rising up here. You know, these professionals we're hearing from are showing us how we all can choose curiosity and connection over judgment and fear.
Yeah.
You hear folks being curious, hearing stories, connecting. That's the vision. That's what we want, not just from the Ambers and the Bradys and the Waynes. Right. From all of us
in the community. Yeah. Any time spent judging, right, is time lost. Getting closer and being more solution oriented. Wayne, I want to check in with you. Anything that jumps out again in terms of what you've seen recently and a story you can put to that?
Yeah, we had a gentleman that came in. He's actually has been a frequent attendee or I don't know how you want to say, been in and out of our shelter for a couple of years, and this person actually was somebody that when I first started case managing, he was probably one of my first people that I had the opportunity to get to know and try to really work with on not just the mental illness side, but also looking for housing and helping him with things as simple as medication management. He didn't take his meds on a regular basis, so we developed we developed a system between me and the rest of the staff at the shelter where we would try to help him take his meds and monitor it a little bit for him to the extent that we could. And he started taking his meds regularly, and eventually he stabilized enough with his mental health, that he was starting to actually search for housing and become more engaged in other things in his life that he needed to do. And he also was able to, once he started stabilizing, he quit drinking, you know, and I find that it's one of the symptoms of mental illness is a lot of people are trying to self-medicate by drinking and sometimes doing other things, other drugs and that kind of stuff. So sometimes when people are able to get their mental illness under control a little bit more with the medications, they don't have to self-medicate like that. And this person actually ended up, we started doing a little bit more of a it takes a village approach with him, in that we have a case manager over at the resource center as well that was working with him, and the three of us really were able to formulate a good strategy to get this person into housing. We got him connected with It Takes a Village, which is one of the programs that we have here at Pillars, and then Crystal is really instrumental in helping him to find a 1-bedroom apartment. And he's in this apartment, and he's gotten, I think he's doing quite well in this apartment. And we do periodically check up on him, and Crystal does a really good job at case managing him. But, you know, to see where he was at the beginning of this process to where he's at now was a complete, you know, 180. And it just, those are the kinds of things that make me proud of not only Pillars, but of the jobs that we see in the community. And it gives us an opportunity to really put a face to the successes that we have, you know. So I'm very proud of that.
Yeah,
situation.
That's always so inspiring to me too. The number of times we hear this is a totally different person, you know, what we saw, and then give that person proper time and attention and opportunity. And all of a sudden you see there's somebody different there. And of course that lends itself to a whole different future as well. We do have at Pillars one funding source, particular, dedicated to helping people who are experiencing homelessness and mental health challenges. And that's called a PATH program, which is available through the state of Wisconsin. Brady, can you talk a little bit about the PATH program and where that fits in for us?
Yeah, so a little bit, I had to write this down because a lot of times from the day-to-day work, you just end up writing off to PATH, and then you start questioning, what is PATH, even though I do it every day. So I had to write it down a little bit. But PATH stands for Projects for Assistance in the Transition for Homelessness. It was created in 1991 and administered by SAMHSA. And that's Substance Abuse and Mental Health Services Administration. They provide funding to encourage organizations to serve those with mental health and fill gaps in services, which is perfect for our shelter, bringing people in right off the street. There are a lot of gaps to fill, a lot of warm handoffs to make. Anyway, so then this provides and serves the most vulnerable of the homeless population, which are usually the hardest to serve, the ones that take a little more time, from rapport to handoff to making those connections, and really gaining that trust. Those with severe and persistent mental health and individuals with co-occurring substance abuse are able to get more support through Pillars to ensure a healthy stabilization for housing. With Pillars case management, PATH funding is just great for us, actually. We're able to provide and or refer clients to basic case management with extra time spent with clients, outreach for those living in a place not meant for habitation, and we have outreach workers that actually put their feet on the ground and get out there and see people who are out on the streets, not able to get past that first barrier of mental health, or it doesn't even just have to be mental health, but it's a basis of really getting out there and making that connection. Like I said, warm handoffs is huge for mental health, introducing yourself, showing what you can connect them to. Mental health, we can do mental health screenings, more connections to the community mental health thanks to PATH. We can connect them to alcohol and drug treatment services, referrals to healthcare. And then we can do a lot of, and then as well as basic needs in shelter too. So, you know, basically being able to order them a birth certificate so they can apply for housing, helping them with transportation services, even paying medication co-pays so they don't have to wait until they get income or get Social Security to get on their meds again, things like that. So, and then with talking about housing part, PATH can also be used as a one-time payment to help with move-in funds once housing is secured as well. So PATH is a huge funding source that really basically enables me to do what I do in shelter with individuals to make sure we appropriately and have enough time with clients to really help improve their mental health and make that a basis so housing stability is ensured.
Great, thanks, Brady. It's
no problem.
All of that, you know, we got to have the, as Lisa said, you've got to have the ability, the funds and ability to invest in the people to be able to work on this. I'll just brag on the Pillars team for a second. So that PATH funding, it's a big grant that comes up every 5 years. We just applied for that. The largest metropolitan areas in the state apply for that: Milwaukee, Racine, Madison, Eau Claire, La Crosse, Green Bay, Appleton, and so on. And under Kathy Dean's leadership, especially her and her team, in a collective effort internally, we put an application in asking for another 5 years of funding on that. And I'm proud to say we scored #1 in the state on our application, our approach, and our plan to do that. And that provides kind of real substantial funding to keep this work going internally. And then we layer that on with what the community provides to make sure that we can do this work and do it with high quality. So we're starting to watch the clock a little bit. Amber, can you give us just a refresher on Partnership Community Health, your qualifications, kind of the what do you do, and specifically around mental health? How does Partnership interact in the community that way?
Sure. So Partnership is a federally qualified health center. That means that we get federal funding and can offer what is called a sliding fee scale, which is something that helps uninsured as well as underinsured patients to receive discounted pricing for their care, just a way to help make things more affordable. We do serve a lot of low-income individuals, and especially obviously those in shelter, those working with Pillars and everything. You know, and part of our federal funding, we also have a 340B drug pricing program. So we work with certain Walgreens in the area just to get discounted pricing on medications as well. So, I mean, we have been, open for well over 20 years. In fact, when we first opened, it was inside of the Salvation Army here, kind of with that idea in mind that, hey, these people experiencing homelessness, they need more support. Healthcare is such a big need. And more recently, we actually had opened up, Joe, you had mentioned the satellite clinic we have at COTS. That was actually in response to the Project Rush study that was done a little while back. Just looking at how healthcare and homelessness kind of tie together, right? So at COTS, they were really seeing that many of their clients were using the ER for things like a sore throat because they didn't have a regular doctor they were going to. And, I'm sure as many of you know, it costs the community a lot of money. These people that are high ER users. You know, we wanted to get away from that. We wanted to teach them the importance of having a provider that you're able to access and build that relationship with. So that way, if your throat is sore, you're not thinking, oh my gosh, I'm going to go to the ER. You're thinking, I need to get in to see my doctor today. So, you know, just with that in mind, we had opened up this satellite clinic, and that's kind of when I got involved in this sort of work. I had been previously doing fundraising at COTS, so kind of just a very big transition for me. You know, like suddenly I was the one that needed to fill appointment slots in the clinic and learn how to check patients in, and then learn how to enroll people into health insurance, you know. So just a lot of pieces that I've picked up along the way, just to help individuals with accessing the care that they need. In terms of behavioral health specifically, a few years back, we actually integrated that with our primary care. So what that means, if somebody comes in as a new medical patient, they're actually given the opportunity, even though they're not there for behavioral health, to receive what we call a warm handoff. I know kind of touching on, Brady, what you had talked about, the warm handoffs too. So they can receive a warm handoff during their medical appointment. So we would actually have one of our behavioral health consultants go into that medical exam room just kind of for a little brief meet and greet. So somebody doesn't have to come in already saying, you know what, I'm gonna commit to doing all these behavioral health appointments. They just get to have that little introduction to it, you know, just to see how do they feel about it. Now, of course, we can certainly schedule somebody for an initial appointment with a behavioral health provider without having them go through that warm handoff too. But it just really opens up our options. Right now, we do have 3 behavioral health providers on our team. We've got 2 licensed counselors, and we also have a social worker. Nobody on that team is able to prescribe medication. So that's where our medical team comes in, and that's kind of that integration piece. So those teams work very closely together on your care. And I think that that really helps to make that patient feel like it really is their healthcare home, you know, to have everybody on that team working together. And we do offer behavioral health services at that satellite clinic at COTS. That's actually the only service we have right now. Medical was put on hold when the pandemic hit, and we still have not resumed that service here. But yeah, because I do work so closely with that COTS clinic, I work a lot with our behavioral health team, you know. So when we have, you know, when we've got patients at Pillars or whatever shelter, like having those concerns, I can even reach out directly to our behavioral health team because we have those, you know, connections within our organization. And that's just such a cool piece of it. Normally how it works to get established with behavioral health, you have to be a medical patient at partnership. But with some of those shelter clients, we have been able to make exception because, you know, we understand that, hey, maybe you already have a medical doctor somewhere else that you have that relationship with, and you're just looking to get counseling. You know, you don't need medications because not everybody is ready to, you know, jump on the medications and that. They really just need somebody to talk to. So we've been able to fill that gap for a number of individuals. And the thing that I love about our services, we don't have that 3 or 4 month wait that you hear about at so many other places. If I'm working with a new client, typically within the next week, we're getting them scheduled. And, you know, I feel like that's almost unheard of. So just to be able to offer that to somebody when they are in a critical position and need that service has been really great.
That's great. And what a great example of meeting people where they are, you know, just where you're at and what do you need, right? We've got a variety of things we can bring, but we're not going to push any of that. We're going to meet you where you are. We're getting close on time. I was going to open it up for questions. There's one in the chat, and this would be a Brady Wayne question, I think, which is knowing that we have a wait list, knowing we only have so many beds at shelter, knowing that we can't serve all of the needs in the community on any given day or night. What about people who aren't in shelter, are connected to Pillars in some other way, maybe through street outreach? Can they still talk to case managers to work with them to find permanent housing? That's a question from Mel. Brady or Wayne, you want to talk about that, how we work with somebody when they're not yet in a shelter setting?
Well, we do have the resource center that I was talking about earlier. We have case management over there for people that are actually out on the streets. And that's one of the things that the PATH funding that Brady was talking about has helped us with. But they can go there and they can access a bunch of resources for housing or jobs or whatever they need. They can either talk. We have advocates over there. We're open Monday through Friday, 8:30 to 4. And that's a place that they can go to begin the process of getting help.
Terrific. Yeah, so we try to make sure that it's not just through our door, right? But we've got a broader connection than that. Let me do this so that we can hit time. Let me wrap up, and then if anybody, as we usually do, if you want to hang around after our official 8:30 stop time, we could just engage in more conversation. But I did want to cover a couple of things. There we go. So sorry to shortchange on the Q&A, but that is always so compelling as you start talking about real examples and people you've worked with. So just a reminder to everybody. So this is to stay connected. It's not just conversations over coffee. We are very active on social media, and if you want to keep a kind of a sense of not only what's happening, kind of big projects and initiatives and personal heartwarming things that happen on a weekly basis. Follow us on your preferred social media. We'll be out there keeping you connected, telling you what our needs are, sharing success stories and all of that. We continue to do conversations over coffee. We do that every other month. So get October 6th on your calendar now. We'd love to see you for that as well. And then I just want to thank you for joining us today. As Lisa said, this is a community effort, and our vision is to be part of a community team as we address these issues of housing instability and homelessness and mental health. I really want to thank Wayne and Brady and Amber for spending time today talking about this. This is really hard work. There is no guarantee. It is not as an example of the harder I work, the better things turn out. It's a bumpy road, and you just have to take every day as it comes and do the best you can. That takes a special kind of person to have that kind of resilience and that kind of hopefulness to come back to that every day. So I really appreciate what you do and sharing those stories with us today. And with that, I think I will officially close out this conversation over coffee, but feel free to kind of hang around and linger and mingle a little bit. And especially if there's any questions, Brady, Wayne, and Amber, I'm sure will stick around and continue to discuss that. So thanks, everybody, and we'll see you at the next conversation.